Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. Today we'll be having another discussion with Dr. Jill Carnahan, one of the most important voices in the functional medicine world, who has a wonderful new book, Unexpected: Finding Resilience Through Functional Medicine, Science, and Faith. This book documents Jill's personal and professional journey through life and how she's been able to overcome the most severe health challenges, as well as her professional and personal journey. Dr. Jill is a survivor of breast cancer, Crohn's disease, and mold toxicity. And Dr. Carnahan also has a documentary coming out called Dr. Patient, based on her life story. Dr. Jill Carnahan is an MD who runs the Flatiron Functional Medicine Clinic in Louisville, Colorado. Dr. Carnahan is one of the first 100 doctors certified by the Institute of Functional Medicine. Dr. Carnahan is a popular, inspirational speaker and writer, and she often teaches other healthcare practitioners the functional medicine approach. Jill, thank you so much for joining us.
You're welcome. I'm excited to be here.
Excellent. I am too. So please tell us a bit about your life journey and some of the challenges you have faced, starting with perhaps overcoming breast cancer while you were in medical school.
Yeah, so it's interesting because we know the healer's journey, right? And I think I was born a healer and I didn't really know it. I do remember very young wanting to go into some kind of helping space. I never in a million years thought I could be a doctor. That was not even in the vocabulary. I grew up in a farm with farmers. Now, my brothers are engineers, so definitely educated, but it was not, medicine was not in my family. So it was kind of accidental. And interestingly, I grew up with a chiropractor as my kind of primary doctor. Like I really had, my mother was a retired nurse. She retired to be on the farm and raise the 5 of us children. She actually was told that she wouldn't have any children, and then all of a sudden she has 5 over like 10 years of a period. So so as a retired nurse, she definitely would, like, before we go to the doctor, she'd try maybe an herbal remedy, or she'd take us to the chiropractor, and we went to doctors, but we definitely had an idea growing up that food was medicine, that there were ways to start to maybe soothe a fever versus just run to the doctor. So I had that built into my genetics and DNA. And I literally looked at acupuncture school, chiropractic school, all the other traditions. And then right around that same time, I realized, you know what? Maybe I should go into medicine. It was literally my childhood chiropractor who said, Jill, I think you should go into medicine because you could actually make more of a difference. And as we know, I have the greatest respect for my friends who are chiropractors and naturopaths because I learned so much from them. And with this mindset, I literally was like, well, maybe I can go into medicine and kind of infiltrate and learn the system that right now is just the best reimbursed. It's not better, right? And then actually make some changes from the inside out. And I'm so glad that I did, because I really got to look at this system from a very objective view and say, what's good? Like, yeah, if you have a heart attack or a stroke or a car accident, you want to be in a major medical center, right? But if you are really in a chronic illness, some of these complex chronic things that you and I see all the time, mold-related illness, chronic infections like Lyme, autoimmunity, brain inflammation, dementia, diabetes, obesity, there's no drug that cures that. And there's usually no surgery that cures that. So this bigger perspective. And so back even in the midst of medical school, I was making changes. I went to Loyola University. And it was the first group that I created for medical students for integrative medicine. So we started actually bringing in other practitioners and getting exposure to that in medical school. So that's kind of the foundation. And then during medical school, all of a sudden in my 3rd year, during my surgical rotation, we're taught about breast exams, and I do a breast exam, I find a lump. Now I'm 25, actually I was 24 at that time. I wasn't even yet 25. I thought, no big deal. I don't even have time for this. I did not think it was serious. But my husband at the time was insistent that I get it checked out. So I had a mammogram and an ultrasound, and I started realizing by sitting with that radiologist to see the actual images, he was very concerned, but he kind of blew it off because he said, you're 24. 24-year-olds don't get cancer. But the findings here look very suspicious. There's calcifications, there's things that are changing that if you were 55, I'd be highly suspicious. So I kind of knew at that point there might be something going on. Went on to have surgery, and I get a call from the oncologist just a few days after surgery. And she said, Jill, I don't know how to tell you this. You have invasive ductal carcinoma, which is breast cancer, very aggressive. The cells are some of the most aggressive I've seen, which is classic in a younger person. And you're in for the fight of your life. And you know those times in your life when you're like, you know, the World Trade Centers or a death of your father or mother or someone you love. There's those times in your life where you're sitting somewhere or you're in a place and you never, ever forget. Like that moment is totally etched in your memory. The chair you're sitting on, the color of the wallpaper, maybe a song that was playing. That was one of those times for me that, looking back, it was an absolute transformation in my life, and it was for my good. But at the moment, it shouldn't feel like it. I got this diagnosis of cancer, and you hear the word cancer and your life just like stops in a way as far as what does this mean? And I didn't know at that moment. Now I'm 20 plus years out and doing well and free of cancer. But at that moment, you don't know. And I say this because I know a lot of your listeners are probably have dealt with those kinds of conditions or diagnoses, or it might be something for your child or your parents or someone you love. And you hear these words, whether it's cancer or some autoimmune disease or incurable dementia or whatever those things are. And it really does shift and change our perspective. So what happened all of a sudden for me was I went into a whole different realm of education. And it was the most scary, but the most profound education, and far greater on the impact of my career and my practice than any sort of medical textbook.
Great. And then you had another really significant health challenge that may have been partially related to the treatments you had for your breast cancer, which was Crohn's disease.
Yeah, so I get through. So ended up having 3-drug chemotherapy, some of the most aggressive drugs on the planet, because I was young and they wanted me to survive. And literally one of the drugs was I went right to the toxic dose for your heart, that if I would have gotten, you know, 10 mLs more of that, it would have stopped my heart from beating. So very, very toxic chemotherapy, lost all my hair, had massive, massive issues, of course, in my gut. Every rapidly dividing cell in my body was affected. And this is where the Crohn's comes in.
By the way, were you using some integrative approaches at the same time as well?
I was. So I was taking my oncologist said, don't even take vitamin C. And I was like, screw that. I'm going to. Now, I don't advise patients to go against their oncologist. I'm always very, very careful. You need to be, you know, talk to them and decide. But I always do encourage people to trust their intuition, because sometimes we know, like I knew taking a few antioxidants, even though it's not recommended, was better for my body. And I did. I saw a naturopath. I had a prayer, you know, group praying for me. I had lots of friends and family. I had all kinds of things that were not traditional medicine, and they were really powerful. So this 3-drug chemotherapy really destroyed my gut, my skin, a lot of things. I had radiation after that, and then multiple surgeries. So I get through all this, and I'm considered cured of cancer. It was about 9 months later. And all of a sudden I started having cyclical fevers, diarrhea, abdominal pain. And I just literally, I had been out of school for 9 months, was back in rotations, and I didn't want to complain. I grew up on a farm where you're tough, you don't complain. And I don't know if your training was like this, but for us in medical school, unless you were like dead or, you know, hospitalized with a fever, you reported to work. And now post-COVID, we don't do that anymore. But back in the day, when you were sick, you didn't call in sick. You weren't allowed to have, you know, it just wasn't acceptable. So I went to work with these fevers. I didn't tell anyone until one day, about 3 or 4 months into it, I literally passed out in the ER. I was taking a patient's blood pressure. I was rushed into the hospital that night. They found an abscess, went to surgery, emergency surgery overnight. And I never forget getting out of the, you know, surgery, waking up from anesthesia. And the surgeon came to talk to me, and he said, Jill, there's no doubt in my mind, this is Crohn's disease. And here I am, like in the hospital bed, just working the day before. I'm like, what in the world? I just got through cancer. But as you mentioned, it makes so much sense, because toxic chemo drugs, again, I have no regrets. I want to state that clearly. I think it saved my life, and I chose very deliberately. And I think when we make this choice, it's the worst thing we can do is go back and say, well, what if I wouldn't have done that? I never do that. It was toxic, but I chose that and I accepted that. But that toxicity damaged rapidly dividing cells, including those on the lining of my gut. And what happened was it created more intestinal permeability, right? So these leakage of the contents of your gut go into the bloodstream and create an inflammatory effect. And I have a genetic predisposition towards Crohn's. That means that if I get those little lipopolysaccharides, the bacterial coatings going into my immune system, my body reacts more aggressively. So this was how I developed Crohn's, because my body's like, wait, what are these things doing in the blood? Started an inflammatory reaction that actually innocent bystander attacked the gut lining, caused these granulomas, abscesses, and damage. And then there's Crohn's disease.
What was that genetic difference that made you more prone to Crohn's?
It's called NOD2.
Okay.
Risk, it's a SNP, of course. It's high risk
Right.
for Crohn's. Later, I was like, oh, no wonder. And the little description is abnormally robust response to a normal microbiome. So that kind of makes sense, right? Like my response, my immune response, my TNF alpha, my IL-6, my IL-2 was probably 2, 3, 4, 10 times the average for a normal microbial interloper that got through the barrier and then developed Crohn's.
So how did you treat the Crohn's?
Yeah. So part of my story is I go to the gastroenterologist. I'm like, what do I have? What do I do about this? And he says, this is lifelong. It's incurable. He's very depressing. And you're going to need steroids. Like right now, you probably should be on steroids. You're going to need immune modulating drugs. You're probably going to need surgery to take out part of your colon over your lifetime. And this is permanent and very depressing. And I remember leaving that office and saying one thing. I said, you know what? I want to do whatever I can. And I know that there's other things that might help. Does diet have anything to do with this? And he did not even pause. He said, Joel, diet has nothing to do with this. And that was, again, where I had to trust my intuition, because I was just a mere third-year medical student. I didn't really know a lot. I knew my limitations. But I'm like, that doesn't feel right. Like, intuitive. How can diet not have anything to do with this? And then my Swiss German kind of stubbornness kicked in. I was like, screw that. I'm going to figure this out. And I went to the library and started looking, and I came across the specific carbohydrate diet, which Elaine Gottschall made famous in her book, Breaking the Vicious Cycle. And I was like, gosh, what do I have to lose? I might as well try this. Well, I think there was a couple of things. I think that diet really does work. It's one of the first things I do for patients with Crohn's and colitis, because it takes out certain disaccharides and monosaccharides that feed SIBO, right? So now we know, okay, there's an underlying piece here. You're clearing out the excess bacteria that's triggering that abnormal immune response by the dietary changes. And within 2 weeks of changing my diet, I had no more fevers. I had no more pain. Now, it took me years to really feel cured from Crohn's, because I worked on the microbiome over the next several years. But I knew within 2 weeks that this was powerful in the healing process.
Well, the gastrointestinal field hasn't really changed that much. For the most part, gastroenterologists don't often prescribe changes in diet for most gastrointestinal conditions, even in 2023.
Yes, sadly. And I just literally, as I'm teaching this in lectures and stuff, pulled, I think it was 2022, an article where they started to say, well, maybe there's something to do, but it was still like not enough evidence. And the thing is, as you and I know, there's interventions that can be really dangerous, like some of these really, really toxic drugs. Like, to say this has benefit, you really need to have the evidence. But for things like changing your diet and getting rid of sugar or processed foods or adding a little vitamin C, if the benefit is great potential, even if we don't have great data and the risk is very low, there's no reason we shouldn't move forward.
Absolutely. And, on the other hand, the traditional or the current state-of-the-art treatments for Crohn's disease is to give you drugs that block your immune system.
Yeah.
And we obviously learned the last few years how significant that can be, not having a healthy functioning immune system.
Yeah, so critical. And like you said, people don't think about those side effects and it's literally, if you look at the drug warnings of Humira and all the new TNF alpha blockers and other
Right.
meds directed towards blocking certain cytokines that contribute to Crohn's. First of all, I will say there's some people that are so sick that those do really save their lives or get
Sure.
to. And I have a lot of people who come in on those drugs, and I never say stop the drug. I go to the root cause and give them time, even up to years, to reverse that. So I want to mention that if you're on the drugs, don't stop the drugs. They might be saving your life. But like you said, what happens is that's not the root cause. And the literally warning label in the medical literature is don't take if you have TB, don't take if you have fungal infections, don't take if you have any opportunistic viral infections. And guess what I found? In Crohn's disease, one of the markers they do in LabCorp that's a predictive panel for the aggressiveness of Crohn's is a panel of anti-carbohydrate, anti-candida, anti-Saccharomyces antibodies. And I found one of the biggest things that changes the progression of Crohn's and colitis is seeing if there's a fungal burden. And I would guess in my clinical practice, 80% of the patients that come in with Crohn's or colitis have a fungal burden. So why would you put them on something that blocks their ability to take care of that fungus?
Interesting. That's fascinating. How do you test for fungus? Because fungus is tricky. It doesn't always come up on stool tests. And a lot of us are using organic acids.
I'm so glad you asked that. I love teaching about this because I think this is actually, you're getting to the heart of my Crohn's. My remission was absolutely maybe 80% based on me clearing SIFO, small intestinal fungal overgrowth. I think from a child, I had a more weakened immune system, and I have some other mitochondria defects that caused me to have more trouble fighting yeast. And I think for me, that was a huge player in the development of Crohn's. And so me treating over the last 20 years, that fungal burden has been the absolute number one thing that has brought me into not only remission, but cure. So how do you test, right? So this is really important because a lot of functional docs, they start with a stool test and they don't see it. They're like, okay, no fungus. Just like you said, it's very low sensitivity. So if you have fungus in the colon, which is actually usually in the small bowel, not the colon, it might even be in the stomach or duodenum, and even in the mouth, the esophagus, it may be way up high in the gut. So on the stool test, you may not see it. If you do see it, you might see it as 1+ candida, and it says green, and the testing company will be like, oh, it's no big deal. I treat anyone who has yeast in the stool, even if it's 1+ small levels, and they have symptoms. So symptoms plus, you mentioned organic acids. That's one of my favorite ways to test. Arabinose is really, really common on all organic acids, and a lot of our test companies have a lot more. The one I use has, I think, 9 markers of yeast and fungus. So I look at that very carefully.
Which test is that?
Yeah, so I like the Mosaic Oat. It's the Great Plains formerly.
Oh, okay.
Yeah. Very, very detailed for these yeast markers. And you can also see if you see oxalates elevated in the urine. Oxalates are made by mold and yeast. So they're coming from that source, unless you just have massive oxalate load in your diet. And so often if you see both arabinose and oxalates, you're like, oh, there's a fungal burden here. Now, a third test you can do that is also sensitive and specific is Candida, IgG, IgM, and IgA. And you can do that on LabCorp or Quest or any standard lab. And a lot of docs are like, oh, well, that's like IgG for Candida. That just means past exposure. The truth is this: IgE develops when something crosses over from the gut lumen to the bloodstream. So unless you have exposure in the blood to Candida, you're not going to develop an IgG antibody. And the only way you can get that is through a permeable gut and a load of Candida. And I do see those markers go down as we treat. So again, this is my clinical experience, but I am treating if I have elevated IgG or IgA levels, and IgM is less common because that's kind of an acute one, but that's real important as well.
Interesting. Yeah. Alana Gurvich, she was talking about using that test as well.
Yeah, it's wonderful. One of my favorites.
I'm going to have to add that. So your third major health challenge was your experience with mold toxicity.
Yeah. So, okay, I get through cancer and Crohn's. I graduated from medical school a year late because I took time for medical treatment, and I'm out and practicing it. Now, it took me a while, and the chemo was hard on my body. I started growing my hair back, but I really, by the time maybe 6-7 years out, I was running marathons, hiking, skiing, very healthy and robust, and I felt like I had recovered. Interesting, I don't always talk a lot about this. So the chemo actually caused me to be amenorrheic, almost menopausal for 2 years. So for a while, I thought I was going to be permanently menopausal at 25. My cycles came back and everything was working. So I moved out to Colorado, started my practice here as a functional medicine consultant, and was doing fine. And then 2013, there was a massive flood in Boulder. And now, sadly, we're hearing this all over the world. And I think about the mold effects of these, floods and hurricanes. But we had this massive flood. And my office already had some issues. That was an older building, and the basement flooded. And now I look back and it makes so much sense. I was right over, I was on the second floor over a unfinished crawl space that was a standing water. My actual office itself, we had a contractor come in and make it really beautiful. And they just decided to put beautiful new bamboo flooring over old, like 20-year-old carpet. Like, duh. right? Mold
Horrible.
sandwich. And then under my office was this unfinished crawl space. And in the basement, 2 stories down, was like bulk Stachybotrys black mold. So when we had that water damage come in, it just accentuated all of that stuff that was already happening in that building. And what I started feeling was exhaustion, red, irritated eyes. I had rashes from the histamine. I had brain fog. I had frequent infections, so weakened immune system. I got really, really sick. And it's funny because back then I knew mold could be a cause, but this is where I have a lot of compassion for patients because I was in denial. I did not want to know that mold was an issue because that meant my workplace, my car, my home, something would be affected. Finally, though, I got so sick, I had to do something about it. I checked urinary mycotoxins, and then I also did a inspection in the basement, and I found that the match there was I had trichocythanes, which are black Stachybotrys kind of toxins in the urine, and then I also saw the bulk sample came back, and Dr. Weitz, when I found that out, I literally never again set foot in that office. I left, I started over. It took a while to heal, but I had to become the expert just so that I could heal myself.
Wow. That's a lot to go through.
Yeah, I guess that's what I said. Now I look back, I'm like, oh, duh, the healer. That's the soul's journey as a healer is to kind of learn. And now it's funny because looking back, these were hard things, right? And anyone who's going through cancer or Crohn's or any of those things can be difficult. But what happens during it is the development of deep compassion is unparalleled. And so for me to be able to like sit in that patient's shoes and really understand where they have been, I have the deepest compassion. And I also, there's little tiny things like cancer and Crohn's connection, and even in the chemo treatment, and then the connection between Candida and Crohn's and all these things I would have never, there's no medical textbook that's teaching that. So putting together the pieces of the puzzle to take patients to another level on this kind of journey with functional integrated medicine, there were so many things I learned through my own experience that I could have never gotten in a book.
And the connection between fungal overgrowth and mold. I treat a lot of patients for mold toxicity and mycotoxins, and we often see that they also have fungal overgrowth, which seems to go hand in hand with the mold toxicity.
Now, I look back, I'll tell you something I've just been talking about very recently. It's not even in the book, is I grew up on a farm, lots of corn and soybeans. Corn is known to be contaminated with a mold called Fusarium. Fusarium, I just read the research just this year, massively correlated with cancers and development.
Wow.
And I look back, and again, I think the pesticides and lots of other things on the farm were contributory to my development of cancer at an early age. Many of them are endocrine disruptors. But this new bit of data on Fusarium made me go, oh, I wonder if mold was at the root all along, or at least one of the players.
Wow. When you think about all the toxic chemicals, now you're talking about mold. It's surprising that anybody who lives on a farm lives very long.
Honestly, you're right. Like I look back and and I look at my mother, like she was so resilient and lovely and a great mother. But she was tired a lot. If I look back, she probably would have had chronic fatigue, fibromyalgia, migraines. And I think, as I tell my story, I think that in utero, she probably had a massive toxic load. And I bet I even got some of that in utero through my mother's, placenta.
Fascinating. In the book, one of the things you mentioned is this philosophy of believe, act, wait. Maybe you can explain what that is.
Sure. So it's so interesting that when we write or journal or do these kind of inner work things, for me, it's funny. The book ended up being a beautiful therapy I never expected, because what happens is as we start to really put together, this is what I went through, this is maybe more meaning and purpose of the suffering and difficulties. What happens is patterns start to emerge. And this was one of those things that literally I never went in saying, I'm going to write a chapter called Believe, Act, Wait. What I did is I started to tell stories. And as I told stories, I thought, oh my goodness, there's a theme emerging. And this theme is chapter 4, Believe, Act, Wait. So it literally came to me as I'm writing this stuff. And what Believe, Act, Wait is for me, it's kind of my formula for life. And I wanted to share it because I do think it's powerful. What it is if we believe in possibilities. This could be, I can be a doctor, I can go to medical school, or I can overcome cancer, or I can leave a job I'm stuck in and it's so miserable, and find a new career or a new job at 55 years old. Like these things that we maybe think are like difficult or impossible. The first step to achieving your dreams, or where your soul wants to go or grow or learn or transform, is believing that something is possible. And now I come from a faith perspective, but I'm very open to the people who have no faith perspective. It still works because you can still manifest by believing. For me, I do believe in God and I believe in a higher power, and I have that as part of who I am. But again, I'm very open to the fact that you don't have to believe in anything religious to have this actually work. You can believe that something else is possible. And when you have that belief, that's what starts the action of the next step. The next is to act. Act just means we do what we can. So for me, it's maybe going to medical school. I'm going to be a doctor, or maybe doing that application, the first application that you put off. For cancer, it's like, okay, let me talk to a naturopath. Let me talk to an oncologist. Let me get some options. Let me go to the library and spend hours and hours reading the literature on what works and what doesn't work for breast cancer, for ductal carcinoma. And so you act and you do what is possible within your realm of your life and health and sleep and family. And you do those things that will take you towards your goal. And then the wait part is where the divine or the manifesting power, the kind of whatever you have belief in, for me, it is very divine. It's a prayer and meditation. I wait for the unexpected, the things that I can't do on my own to happen. So for example, I found a phenomenal doctor that helped me with a very special type of radiation during my therapy, and I feel like it partially saved my life. And that was such a coincidental meeting of how I got to know him, how I found out what he was doing. That was nothing of my own accord. It was literally the waiting, and that came to me. So
that's something I hadn't heard about. Can you describe that type of radiation? Is that something that's still being done for breast cancer?
Yeah, so this was 20 plus years ago. And at that time, it was called brachytherapy. And there's this doctor that was doing this it was very experimental. And what they would do is, so when you have external, so first of all, lumpectomy almost always is followed by external beam radiation. So what they do is they take out the tumor and the section of the breast that's affected, and they give a large margin, like 2 centimeters or greater, around the tumor. So they get all that tumor out. And then they go back in and they externally beam, hit radiation. They still do this 20 years later. But the external beam, it was on my left, right? So guess what organ is right under the breast? It's the heart.
Yeah.
So the external beam radiation, number one, it damages the skin. So people have terrible radiation burns on the skin because this beam goes right through the skin. Number two, even if they're really careful with the physics of that beam, it gets to the heart and to the lungs. And a lot of people have permanent heart damage or lung damage to those tissues because it goes right through and splays onto the heart or the lungs. I knew that. So I thought, how in the world could I get this safety of treating any remaining cells, but not hurt my heart and lungs and my skin? So this guy, what he did was back in the day when I got it, they literally implanted via tubes, these little hollow tubes, where they would, over my treatment of 5 days, twice a day, they would put iridium beads through that. And the physics of the machine would calculate exactly where the area of that breast was. So it's basically like radiating from the inside out. So in that pocket where the tumor was taken, there's these tubes where the radiation would go inside, and they would calculate just seconds it would pass through, and it would pass through just in that internal section. So it literally was like a microwave cooking from the inside out. As crazy as that sounds. But with that, I had no heart and no lung damage, and my skin was fine, except for those tubes that went in and out and had to heal. No big deal. So that was profound. And now it's called mammocyte. There's a couple other devices where they literally do a surgery and they'll implant a little thing, like a little pocket inside the tumor region, and they'll put radiation in that pocket. That's another way to do it. And for prostate cancer, brachytherapy has become very, very common. So the same thing, they'll do those tubes into the prostate and radiate from the inside out so that you don't have damage to the rectum or anything else when you're treating the prostate.
Yeah, I think I heard some discussion about it. And I think this one doctor was saying that the reimbursement for that procedure is not very good, so they don't do it that often.
Isn't that crazy? And I'll tell you, like, I believe it was the best thing I could have ever done because my heart and lungs are great. My skin was great and it treated me and I'm fine. But what happened was I had to go to this doctor. All he was doing was experimental. There was no standard at all. So he had a study. That's the only way I could get him, was to be in his study. And his study was all these, 55, 65, 75-year-old women, very low risk. So I literally had to beg him to say, can I please be in your study? I know I might ruin it if I die. but he took me.
So to talk a little bit about some clinical things, in your book, you have these gray sections that are like pearls of wisdom about health. So I thought maybe we could talk about a few of these.
Sure.
So the first one you discuss is lab tests everyone should consider by age 30. Maybe you want to could talk about some of those tests that you think are important screens for, overall health, above and beyond the normal lab tests that patients get. It's interesting. I often talk to patients and they go, well, I went to my primary care doctor and I had all the tests done. And they think they had every test that could possibly be run because they had a CBC and a chem screen and maybe a basic lipid profile.
Yeah, I literally grabbed the book so I can make sure that I give you the right information because it's all kind of here, but so
right. Yeah.
So this was important. Like you said, what happened was, and I'll just tell you the background on that. I wanted this book to be something you could curl up with a good cup of tea at the night and, be kind of engrossed in the story. And all the books that I love are great stories first, and the teaching is second. And so I wanted it to be like you're sitting with me and I'm telling you a story about my life or about a patient. But I also wanted to include this really practical tips. And I thought, how in the world? It took me months to figure out with the publisher, how do we do this? And that's what you mentioned with the gray bars. Those are actually just really practical takeaways. Here's how you treat mold. Here's how you deal with lab, issues or whatever. But then you can stay in the story in between those boxes. So that's what you're talking about there.
Exactly.
So basic things like CMP, CBC, which are standard, are going to check liver, kidney, all that. That's pretty standard. But Some of the other things you might want to do are advanced inflammatory markers for the heart, things like CRP, TMAO, PLAC, which is plaque, MPO, myeloperoxidase oxidation. These are all markers of more detailed inflammatory processes. And if that's going on, you can look backwards and say, is there an infection or something else going on, the gut disturbance? Complete thyroid panel. This is huge. So not only TSH, which is the standard, but free T3, free T4, TPO antibodies, thyroglobulin antibodies, and even reverse T3. Those are all kind of going to be comprehensive. So you can see where the thyroid is, where it's going. Complete hormone. So you can do this through blood work like estradiol, progesterone, free and total testosterone, DHEAS, and cortisol, morning cortisol. You can also do it through a lab like, say, Dutch Complete or ZRT. There's a couple out there where they literally will test the cortisol through the day. That's super helpful to see adrenal function. And you're missing the boat if you don't get the hormones because those are playing so much into our lives and our aging and our feeling well and all those good things. Autoimmune markers, I always feel like checking ANA and then the ENA panel, which includes like Sjogren's antibodies, anti-double-stranded DNA, and those great screening to see if there's any autoimmunity. And since the pandemic, I've been adding on anti-cardiolipin antibodies, which are really crucial for antiphospholipid syndromes, which are more the blood clotting disorders. So I'm checking people for that now. You would be shocked at how many people have an elevated D-dimer, which means they're breaking down fibrin, making clot, and they need to be treated. So really, really important. Vitamin D, really basic. A lot of docs don't test this. Medicare doesn't even cover it. And it's crucial for our immune system. I like to see that between 50 and 80. It can go up to 100, but that's kind of an ideal range. Fatty acid testing, you can get on a routine lab panel, fatty acids, so you can see your omega-3, 6, 9, your EPA, your DHA, and those are crucial to brain health, to detox, to inflammation. Iron studies, really important. And we often think about anemia or low iron, but high iron, hemochromatosis, is also an issue. So it's real important to make sure you're not too high or too low. Just a quick antidote here. I have a patient who had hair loss at 14, total alopecia totalis, which means poor 14-year-old had no hair. She had lost it. And underlying part of her issue was gluten intolerance, but also undiagnosed hemochromatosis. Now, normally that girl would have gone till 50, 60 years old. She would have started to have a liver failure. And the doc would have been like, why are you having liver failure? They would have found this high iron and it would be too late. She'd probably have to have a liver transplant. Fortunately for me, because I'm checking this all the time, I found the hemochromatosis at 14 years old. And I guarantee that girl is going to have a totally different life because we're treating her right now for that disease that at 50 could have actually killed her.
That's great.
Well,
how are you treating her?
So we do therapeutic phlebotomy, just like if you were to give blood, that's what it's ordered. And usually every 8 to 12 weeks. Now I think she's on every maybe 4 months, and that will literally decrease the hemoglobin. It's interesting. Another little caveat here: postmenopausal women, they actually increase their risk of heart disease, stroke, heart attack above that of men as soon as they hit menopause. And one of my theories, and this is backed by science, is that all of a sudden women who are no longer menstruating have a higher accumulation of iron. Iron is very inflammatory. And then with the hormone levels changing after menopause, they're also at higher risk of clot. So these things actually play into all ages of women with iron too much or too little.
Interesting.
Yeah. Those are the main, I guess, fasting insulin, fasting glucose, making sure metabolically, those are a few of the others, but that's most of the ones that are there in my list.
Right. Great. So another one of your sections, maybe I should have written down the page numbers for you.
I'll find it. I'll see how quick I am.
is the one on neuroplasticity and how to enhance it. So we're talking about, essentially brain health and how to reduce our risk of these chronic neurological diseases like Alzheimer's.
Yeah. So first of all, what is neuroplasticity? Neuroplasticity is how our ability of our brain to kind of rewire. So I see all the time people with Lyme or mold or chronic HSV infection or things that could long-term cause a decline in cognitive performance. Or, for example, someone who has microvascular issues where they're having little baby clots in their brain. And all of these things will actually cause damage to the brain. But our brain is so amazing. If we have it's almost like the heart. You can have a heart attack and your body will rewire around there. So like the same with the brain, if we have one chemical pathway that's not working, one neural, pathway that's not working, our body can actually go around. It's like a rerouted stream. So that's what happens with neuroplasticity. Now, how do we increase that? Increasing neuroplasticity is very simple and usually pretty fun. So things like games or puzzles are great. Driving a new way to work, going to a new country where you hear a different language or you try even speaking a different language, doing things differently, maybe just changing up your routine in your day, especially like I said, driving a new way to work, puzzles, words, word kinds of crossword things, all those new games in the New York Times. Some of my friends do those every single day. And see, reading is probably the number one thing that's related to neuroplasticity.
Yeah. So novel stresses to the brain to cause the brain to improve its various capacities. Okay. So the next one is living well in a toxic world by promoting clean air, clean water, clean food, clean mind, and a clean body.
Yeah, so I love this because it just happened one day. I don't know when I said it first, but it's one of those things that you and I do a lot of integrative functional medicine and principles, and there's lots of complex things, right? Like we're looking at, does the patient do better on glutathione or NAC or whatever? And we can get lost in the minutia, or we can get lost in these expensive IV medications, peptide therapies, and these things are wonderful. Or buying a PEMF mat. But the truth is, sometimes very simple moves the needle more. And I love this because clean air, clean water, clean food. When I say that, most patients are like, oh, wait, it doesn't have to be overwhelming or hard or expensive. I can do this. It gives the patient, the people we're dealing with, even your listeners, the permission to do something that's doable and affordable that's actually going to move the needle. And I really believe this foundation is so crucial because if you can have clean air, so making sure you have air filters or open your windows or getting air exchange. I'm a huge fan of a HEPA and a VOC filter. So things like IQ Air, Austin Air, Air Doctor, and there's many more. In your house would be great. But even if you can't afford an air filter, you can open your windows, you can exchange air. Now that would be in the case that you don't have tons of exhaust right outside your door or a wildfire or something, because certainly sometimes the outdoor air is a lot more contaminated. But clean air is crucial. And we have so many studies that show that nanoparticulate from exhaust and diesel fuels actually can contribute to autoimmunity and Alzheimer's and the many chronic issues that we see. So really, really crucial. Clean air, clean water. Making sure that the sources of water that you get, ideally a whole house reverse osmosis system would be great, but you can literally, right now I have a pitcher in my fridge from Clearly Filtered. That works. And I have a condo, so it's harder to do the reverse osmosis system. Someday I may have that, but I don't right now. I have a $30 water pitcher in my fridge, and it filters out 200 of the top chemicals. So that can work. But you want to make sure you're not drinking tap water. You're not drinking bottled water. Last summer, this became even more evident as the test from the Colorado water supply where I live came out publicly. And it showed that every single water source they tested was contaminated with PFAs. These are polyfluorinated compounds like Teflon and Gore-Tex, and they're forever chemicals. So in 50 years, they probably will still be the same levels. They're not going to go away anytime soon. So filtering your water.
Those are all across the country, either in Southern California where we are. They're really everywhere.
Yeah, it's literally, and again, it's sad because there's no way to get rid of them. I mean, we can filter them out of our drinking water for sure, and our bathing water, but they're in the water supply and they're not going anywhere. So because of that, clean air, clean water, clean food, this is making choices every day within
and they're still being added to the water supply. They're in these flame retardant chemicals that they use to put out fires. So they're proliferating even more.
Yeah, I think this is the secret of our chronic illness and our exponentially rise in autoimmunity is the toxic load in our environment is just so increasing quicker than we can possibly handle. Like our bodies are designed to detox. And if you give the right tools, we can really get well. But I think what's happening is we're all drowning in the bucket of toxicity. And
it's crazy. We spray flame retardant chemicals on our mattress, and it's like a big deal to try to get a mattress that doesn't have flame retardant chemicals in it. It's insane.
You're so right. Even like baby, the outfits they wear and things, clothing, all of it is mandated to have flame retardants because they don't want the babies to get, but it's like so toxic, right?
It's ridiculous. Yeah.
Yeah. So clean food, this can be as basic as choosing like the Dirty Dozen on our environmental working group tells you the top 12 foods that are most contaminated with pesticides every year. So choosing to buy organic for those, ideally all organic if you can, locally grown, sustainable, all those kinds of things. Good example is salmon. Farm salmon is one of the most toxic foods you can consume. It has PCBs and mercury. Wild salmon is one of the most healthy foods you can consume. So choosing to pay a little bit more for wild salmon is going to be worth it in the long run.
By the way, here's a hint. A lot of the restaurants around here and stores sell wild Scottish salmon. It's not wild. It's grown in pens in the ocean. And they're saying because it's grown in these big pens that it's actually wild, but it's not.
Yes, I've seen that. And it's funny, restaurants too, they love to put wild or they've Scottish or whatever. You're right. It's like, and the studies that show those pens and those farm salmon, first of all, there's massive amounts of fish viral diseases. So there's infections. Second of all, the PCB levels are off the charts. So just that alone, if there's no mercury, is an issue. And it really, really sadly is people think they're eating healthy. I had a guy the other day just come in and mercury off the charts. I said, what are you even doing? He said, well, just 2 years ago, I started changing. I wanted to lose weight. And for lunches at work, I found this place that had these bowls and they had salmon. I thought I'm eating healthy. So I would have that every single day. It's like, oh my goodness, how sad. He's, eating this lettuce and beautiful, but it's like the source doesn't matter.
And most salmon at sushi bars is farmed as well.
Yes, exactly. If you're eating restaurants and you're getting your fish from restaurants, unless you know that restaurateur is an organic sourcing, which is rare, extremely rare, you're getting not good source.
Very few restaurants serve wild fish. Yeah, that's too bad. Yeah. Okay, let's see. One more. Steps to prevent mold growth.
Okay. So this is just, it's interesting because if I suspect mold in a patient from testing or from their history, if I just go out and say, do you have mold in your house? 99% of people will say no, because they're like, oh, I don't see mold, right? So You have to be creative in how you ask. And this is partially for preventing mold growth too. So things like, first, a simple example. Last summer, I'm in a condo, so multi-level, and my neighbor above me had a fridge leak that went down into my wall and down into my floor, and I had Cardiometabolic growing in my kitchen from that leak. Wow. I learned that, and I just was like, because it wasn't my fridge, but because the fridge water line I've seen so many cases of fridge water lines leaking from improper installation. I'm like, disconnect my line. I can make my own ice cubes. This is not worth it. And I tell patients who have mold, don't connect your fridge. It's not worth that risk of that leaking into the wall. I've seen so many problems. So simple thing is just disconnect your fridge water line, turn it off, make your own ice cubes. It's so easy. It's not a big deal. Under your sinks and things, you should have those. You can buy them at Home Depot and Lowe's. They're rubber mats that will protect your wood from if there is an accidental leak, because how many of you out there have had a leak under your sink? I would say 90% of people, right?
Sure.
And that literally can cause enough mold growth to cause an issue. So putting the pads, and they often come with a little water sensor. So under all of my sinks, I have pads to protect from water damage, accidental, with a water sensor. Things like attics and crawl spaces. You need to know, literally, I went to Australia a few weeks ago, and a building biologist there was one of the best lectures I'd ever heard. She talked about moisture is the problem, not mold. And I love that framework, because if we think about it as intrusion of moisture, condensation, leakage of windows, so making sure your windows are sealed, making sure your crawl space is sealed, especially if you pull air. A lot of houses pull air from the crawl space. If there's mold in there, you're pulling air from a moldy area. So often attics or crawl spaces aren't properly maintained. They get condensation, they get water damage, they get leaks from hurricanes or roof damage, or the crawl space isn't finished. And if you have air exchange from either the attic or the crawl space, you're pulling air into your system from a moldy environment. Like I said, windows, condensation, improperly sealed siding, your foundation. If you're below grade and your foundation isn't, stable and sealed, a lot of people will get water intrusion through their foundation. Sump pumps or places in your basement that are pulling out water, if they're just sitting water. I looked once in a while for new homes and done some like walking through them. And most of the time, if I'm looking at the homes, the places I find issues are basements, crawl spaces, or the sump pumps. So these are all just like little practical things. But home maintenance and your gutters. If your gutters are full of leaves, you should be 2, 3, 4 times a year cleaning out those gutters. And if you're not doing that or not hiring someone to do that, then what happens is they get full and that water will leak past the gutters right into the wall of your home. And those are some of the bigger issues: the foundations, the walls of the home, the attics, the crawl spaces, and they really, really affect the mold in the home.
And a lot of the newer homes or the newer construction is being designed to make sure the homes are airtight. And this is partially to be energy efficient. And that means that if there is moisture, it can't get out, and it's more likely to create mold inside the walls.
You're absolutely right. 2 little things here, because this new energy efficiency and solar power and all these things, wonderful for our environment. I'm all for it. But you have to understand what it could be doing. The energy efficiency, like you said, is very, very tightly constructed. And so if there is a difference in the moisture in the home, the humidity in the home versus outside, you're going to have condensation. So if your home is more humid, and just like this building biologist from Australia was saying, if you do a shower, if you breathe out, we're literally all the time, I think she said each person in a house produces 40 liters of vapor a day. Don't quote me on that because I might have it wrong, but it was such an astronomical number. I was like, you're kidding me.
Wow.
And your college kids in there for 30 minutes, the steam's going up and they don't turn the fan. You're guaranteed to have mold growth on that, particle board, because it's just getting wet and damp, and so you have to have the fans, you have to have them properly installed. And that moisture in the house is actually the issue.
Yeah. Great. Any final thoughts for our listeners and viewers?
Well, thanks for taking me on the journey through my I really enjoyed talking to you about that.
And thank you for taking me and the other readers on the journey through your book, through your whole life's journey.
Yeah, I think the biggest takeaway is I'm not unique. People read the book and like, oh my gosh, I can't believe you've been through all that. The truth is, everyone out there has the same potential. And when we change, that's why the believe, act, wait, or some way of reframing your story is so powerful. And I just tell my story because I've learned through the difficulties and the good and how to do that. So my takeaway would be, if you're facing difficulty or disaster or financial issues or health issues or a child or a parent who's sick or all these many things that can go wrong in our lives, first of all, difficulties and suffering are going to happen. And when we know that, we're not caught off guard. Like my book title, Unexpected, right? Unexpected things are going to happen. And if we have that frame of like, how are we going to deal with something when the curveball gets thrown our way, instead of being shocked and be like, why me? We change that frame and we say, why not me? And how can I take this and turn it into something that actually helps me transform into a better person, a better human, and all those things. And I think when we have that framework, it's still hard. It's still suffering. It can still be so painful. And I don't deny any of that. But when we have a framework, we can literally transform suffering into something that turns out to be a really beautiful thing.
Do you want to provide contacts for your office or your book or both?
Oh, thank you. My regular website is just my name, jillcarnahan.com. Everything you ever want to know about mold and everything, it's articles and blogs, it's all free. I have a podcast you can get on iTunes, YouTube, Stitcher, whatever. And if you want more about the book, go to readunexpected.com. Lots of free resources there as well.
That's great. Thank you so much, Jill.
You are so welcome.
Thank you for making it all the way through this episode of the Rational Wellness Podcast. For those of you who enjoy listening to the Rational Wellness Podcast, I would certainly appreciate it if you could go to Apple Podcasts or Spotify and give us a 5-star ratings and review. That way, more people will discover the Rational Wellness Podcast. And I wanted to let everybody know that I do have some openings for new patients, so I can see you for a functional medicine consultation for specific health issues like gut problems, autoimmune diseases, cardiometabolic conditions, or for an executive health screen, and to help you promote longevity and take a deeper dive into some of those factors that can lead to chronic diseases along the way. And that usually means we're going to do some more detailed lab work, stool testing, sometimes urine testing, and we're going to look at a lot more details to get a better picture of your overall health from a preventative functional medicine perspective. So if you're interested, please call my Santa Monica Weitz Sports Chiropractic and Nutrition office at 310-395-3111, and we can set you up for a new consultation for functional medicine. I'll talk to everybody next week.